China has termed its COVID data transparent, even though official figures from China have become unreliable. Amid criticism over stopping daily COVID count, Chinese officials and World Health Organization experts on Friday exchanged views on current COVID situation. In the online meeting, the World Health Organization urged China to provide more data on genetic sequencing, hospitalizations, deaths and vaccinations. WHO also called on China to strengthen viral sequencing, clinical management and impact assessment, and expressed willingness to provide support in these areas. The question is, as the WHO continues to urge China to share the data, can the organization be trusted given the lack of results? That is the latest we are tracking for you on the broadcast. At this point of time, I've been joined by Dr. Naresh Chawla, he's an health expert, and Ambassador Suresh Kumar Goel to speak more on this. I start with Ambassador Goel. How do you view these situations now arising? Another time, second time we are seeing the same situation wherein China is hiding the real numbers, WHO urging China to provide the key data, COVID management data, but is it reliable to trust either China or WHO at this point of time?
Reliable data from China, and China actually has been obstructing any kind of action on reliable handling of the COVID pandemic. You remember the team that had to be sent by WHO, and they were admitted to the laboratory only after the period of 6 months, by which they had actually cleaned out all possible evidences of any possible virological evidences of the virus having come from Wuhan. Therefore, I don't think that there is any way we can rely on China to share data with us. It is just not in their genes. It's not their DNA to share data. They are very, very secretive about it. And more importantly, any loss of face for them is a huge catastrophe. And if it is proved that China is responsible for the spread of COVID, that would be something that they cannot bear. So I think trying to insist on getting data from China is a non-starter. Now, what are the options? Either we stay with the situation as it is and let it be, suspicions, speculations and all that, or we use international means to compel China to share data. And again, China being a Security Council member, those pressure tactics are not going to work on this. So I think it's going to be much of the same really in times to come, where international community will keep on asking data from China, and China will keep on obfuscating and not sharing the data. And eventually, the world will continue to go through the same kind of catastrophe. It sounds very glum, but that is how it is. Priyanka.
Right, Ambassador Goel. Stay on with us. I would like to also take a question from Dr. Naresh Chawla. He's an health expert. Dr. Chawla, when it comes to increasing death rates and spreading of virus, we've seen previously as well that China has not released the correct data. So how alert should India be at this point of time, and what are the ways do you suggest at this point of time for people to be aware and protect themselves with the rising scare amid the outbreak in China?
Priyanka, let me tell you the ground situation. The matter of fact is, although the government as well as the media both are trying to caution the people, but when it comes to ground level, people are just not bothered. So how do we face such a situation? There are two things. First thing, we do not want to create panic, and health-wise also, I would say there is nothing much to worry per se at this time. But what tomorrow holds in store for us, we do not know. So you can only take precautions, which we have started getting tested everybody who comes from the 6 countries where the COVID-19 cases are in abundance. Number 1. Number 2, random testing at airports, which is being done. Number 3, which is most important, which people are not exercising at all, that is the corona appropriate behavior. Let me tell you, for last 10 days, 12 days, ever since the scare has come, although the warnings by the government, warning by the media, warning by the health experts, people have not started using the mask at all. So my advice to the general people through your channel is, at least start following the corona protocol, use of mask, social distancing, don't crowd around, and simple hand washing and sanitization and your immunity and your simple good food. If five these things are followed, then we do not have to bother whatever happens in China. It does not matter to us. Health wise, we are a little better protected because of our good vaccination and because of our natural the infections immunity which we have got. And I would still urge the government of India to make the booster dose of corona free so that people start getting it, because as I have come to know, 75% of Indian population has not taken booster dose. Beyond that, I think we have nothing to worry, because next few days are only celebrations. Today is New Year Day and people will crowd around in a big way. So my advice to people is to enjoy, but take precautions by the way of mask and not crowding out. If they do it, then we have nothing much to worry.
Right. Ambassador Goel, at this point of time, the WHO has made it very clear that in order to make a comprehensive risk assessment of the COVID-19 situation on ground in China, a detailed information is needed. But China keeps playing its own games. China seems to be now putting on another COVID atom bomb part 2 on the world, spreading the virus, sending in infected people. We reported previously that there were 2 flights that went to Milan, and more than 50% of the people, Chinese people in the flights, were positive when they were tested. So what exactly is China doing at this point of time? Hiding the details, spreading the virus across the globe. What exactly is happening as per you?
As in the previous years, China is hiding the facts simply because it cannot face the world with the accusations of spreading the virus. So what China is doing is in Chinese culture, not saving the loss of things. The problem is that why is the world not able to do anything? And that also I explained in the beginning. Now, Dr. Tedros, the head of the WHO, is a creation of China. So I think Dr. Tedros should know how to deal with China to get the data or stop insisting on the data. And as I said before, I don't see any way that anyone in the world can force China to share data if it is not willing. And even if it is willing to share the data, we cannot rely on that data. So I think insisting on data is barking on the wrong path. It is wasting energy. Nobody is going to be able to get it. The only way is that really try and deal with the pandemic within our own known information and resources. Difficult, but is doable, at least to, like Dr. Chawla suggested, take precautions, mask, etc., booster doses, at least you limit the impact of COVID. But otherwise, I'm again repeating, expecting China to share data, reliable data, is an impossible task. We have to, I don't like it, but there is no one who can do it, really force it out of China.
Right. My last question to Dr. Chawla. Dr. Chawla, when it comes to the Chinese vaccines, because China is now reporting a massive outbreak of the COVID virus, what do you think? Have the vaccines failed it, or is it the government that has not been able to curb this situation well?
Priyanka, very good question. Let me tell you, China did 2 wrongs. One, that their vaccine did not work. The efficacy was quite less. Our vaccines which we used in India, including Covaxin and Covishield, are far more effective. Number 2, the zero corona policy of China boomeranged in the sense that it did not expose people. We Indians exposed to it, and a lot of us got subclinical less infections, which provided us natural immunity. As I said, the natural probability in which you Indians have is quite good. I would say up to the extent our immunity is even better than, as an expert, I can openly claim our immunity is better than Chinese, better than even Western world, Europeans, Americans, all of them. So we are sitting quite pretty, but we do not have to sit pretty. As I already said, without bothering about what China does and other nations do, we have to take our precautions. And again, the same corona protocol and booster dose vaccination, if it is taken, then I'm sure we are quite safe. We will have, and let me assure the people of India that as far as I know the situation, it is not going to go bad, but still precautions have to be taken.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.